I'm Laura with Moms on Call, and I wanted to talk to you about the 3 feeding options you may use in your home. In my home, I've nursed exclusively, nursed and did bottles, and our last was a formula-only baby. You may use one of these options, or you might use all 3 in one day. Let's talk about them. Option number 1 is nursing only for a feeding. So you'll start off with what we call the meal. That's the entree. That's that first breast. You want to make sure that that first breast is really soft and mushy, and usually that takes about 20 minutes. Then the second breast is what we call dessert. Usually 10 to 15 minutes on that one. Always alternate which breast you start with at each feed, and feel free to pump the breast that's not empty, so that way you can start to get some stored up. Let's talk about option number 2, which is nursing and topping off. Sometimes this option is recommended by your pediatrician or lactation consultant due to weight issues or some other medical issues that may be going on. With this option, you'll nurse on one breast for about 15 minutes. Then do a bottle of about 15 minutes. Then pump both breasts for 10 to 15 minutes. Now remember, this isn't forever. Sometimes it's just 2 to 3 days, then you can get back to option number 1. Always alternate which breast is offered and increase the amount of that top off gradually as needed. Now we're talking about option number 3, which is a bottle only for a feeding. Now this option may be done exclusively, or you may set one feeding a day that's always a bottle. We have found the best bottles are those old-fashioned bottles. You can see our website for the ones that we love. These bottles can be breast milk or formula. The amount you start off with is determined by the age, and you increase gradually as you need to. Make sure you're feeding sitting up, and don't change formulas unless directed by your pediatrician. We want you to know that the way you feed your little one is not near as important as the heart of the one doing the feeding. This decision is best made by you, the parents, according to the season of life you are in, that baby, and what works. Regardless of what option or options you choose, you are doing a great job. And the truth is, our love for our kids isn't measured by how we feed them. Our online courses give you specific details on feedings. And if you need more personalized support, our consultants are available to walk with you step by step through all the day-to-day realities. You've got this.